Hi, welcome to Precision Diagnostic Imaging. If you're watching this, then your cardiologist has asked that you undergo a PET stress test. A PET stress test is to evaluate the blood flow through your coronary arteries and also your heart muscle. I'll briefly explain what you should expect for your test. When you arrive, you'll be asked to fill out a brief medical history questionnaire and also a consent form. Before you arrive, you will have arrived without having any caffeine for 24 hours. This includes coffee, tea, soft drinks, or chocolate, or also any medications containing caffeine. You will also need to withhold any medications that are considered a beta blocker. If you are claustrophobic, then you can contact your provider and ask them about alternatives or light sedatives. If you are prescribed a light sedative, you will show up 1 hour prior to your test time. You will take those sedatives with us so we can document the time you took them. Once you have filled out the medical questionnaire and also the consent form, one of the medical imaging staff will bring you back.
Once you get into the trailer, we will have you come off to the right and take a seat into our patient prep area. In the patient prep area, one of the technicians will ask you some further medical history questions, and also we'll be placing an IV, and also we'll be putting 13 EKG electrodes on. Throughout the entirety of this test, your heart will be monitored by a paramedic, and also the cardiologist has a live view. If you have a preferred side of an IV on your left arm or your right arm, go ahead and just let one of the technicians know before they start. Once the IV has been started and all the electrodes have been placed, we will then lead you over to our patient exam area where the test will begin. Before we start your test, one of the technicians may ask that you drink some water. Drinking some water right before the test helps calm some gut activity and helps us with the quality of our pictures throughout the entirety of this test. Once in the exam room, we will have you take a seat on the table. This is where we will hook up the rest of our vital sign equipment. Once we've hooked up the rest of our vital sign equipment, we will have you lay down on the table with your head facing the entrance of the scanner. I'll have you swing your legs on up and lay back. Got a pillow under your knees here. Put some pillows under your arms here in a second, and then we'll hook you up with some more wires. Once we have all our monitoring equipment on you, we will begin the test. This test only lasts about 25 to 30 minutes. The first part of this test consists of a quick CAT scan. After the CAT scan, the scanner will automatically push you to the other side of the scanner. Once you're on the other side of the scanner, we will begin the resting portion of the test. The resting portion only lasts about 8 to 10 minutes. Once we're done with the resting portion of the test, we will begin the stress portion. The stress portion of the test only lasts about 3 to 5 minutes. Once the stress portion of the test has concluded, we will take a second CAT scan. After the second CAT scan, the test is finished, and we will pull you all the way out of the tube and disconnect you from any monitoring equipment we have.